Okay, our next presenter is Professor Yeur-Hur. She is a professor of the School of Nursing at the National Taiwan University and the Deputy Director of the Office of the Research and Development College of Medicine in National Taiwan University. Currently, she also is the Director of Nursing at the Department of the Nursing in NTU Cancer Center. Once again, we would like to invite Professor Lai because she is an international well-known scholar, especially in cancer care, especially for the cancer pain and fatigue management, cancer-related quality of life, cancer patient care needs, and supportive cancer care. So today she is going to share with us about living well with cancer, personalized and need-based cancer care. Professor Lai, please.
Thank you very much. I think I learned a lot from our distinguished speakers in front of me. So, and I'm not an expert in this field, in the GI field, but actually my study mostly in head and neck cancer, lung cancer. But we did explore some gastric cancer and colorectal cancer patients' needs. And today I want to show some of the framework about how we prepare and how we assess and how we take care of our patients. And I think perfectly can match Susan's guideline because the guideline is perfect and is, but still, I think it's in the beginning to use the guideline in this disease. So I think I want to share some concept about concerns, impacts, and also the care needs from the group a little bit conceptual view and to bring into this disease and hope to help our patients living better. So okay, let me try. I think in the cancer process, I want to approach from the. We can see clearly see patients in this process. Some patients they are in acute and to chronic and to survival phase and to them dying and then bereavement phase. But for some cancers, they might be very quickly from acute and then to dying. So it depends on what kinds of cancer and also depends on which stage cancer being diagnosed. So all our concept is about in the process what kinds of needs, what kinds of concerns, what kinds of impacts patient faced, and how do nurse can help them, how the healthcare professional can assess and can provide a good care to patients. So in the process, three concepts I want to, first of all, I want to show the quality of life concept. And quality of life is some indicators to our survival patients' treatment outcomes, one of important indicators. So, but however, when we say quality of life, we particularly say the health-related quality of life in cancer populations. And then, this model is very early quality of life model. However, I think it's very useful in viewing our cancer patients. For example, and in the past, we mostly focus more on symptoms part. This is what acute stage, acute treatment stage, and also when patient receiving treatments and also after treatment complications, we concern about this. But however, gradually we also concern about patients' function because daily function is very important to patients. So how do care provider help patient to integrate these factors into patients' cancer process and also assess their needs across the process. These factors are needed to be concerned. Cancer survivor, this term has been pointed out current 10 years from NCI, and particularly in the past we thought cancer survivor is who probably particular for who have survive for more than 3 years. But currently, we have already expanded this definition to all the cancer patients who, as long as they are still alive, they are cancer survivor. So the cancer survivor can be in a very wide range. Can be from the who have a very who is a healthy survivor, or who are still in the treatment, or who are in the very severe levels. And this is another model. This model is particular this is from nurses model. Betty Farrell, she's very famous nurse researcher in City of Hope, I think, and she's mentioned about the model for survivorship care. It's very, I think, easy to help us understand about from a physical part, and also from the psychological concern, and also from the social well-being, and so for just spiritual well-being, from the four main aspects to view a cancer survivor, the survivorship issues. So mostly we concern this part. We also concern this part. However, so many parts. When we give a patient education, what kinds of intervention should we give to our patients? Patients have so many concerns, and so patient may be different. So this is what we want to say about the survivorship care program, which can bring more individualized care. So then we think about the care across the cancer process. Three main concepts want to bring. First is supportive care in cancer. The second is supportive care needs. Patients' needs in this process, and then how to make a survivorship care plan based on our assessment. And supportive care in cancer, this is the definition actually is from 2008 in Boston. I was one of the a committee member in the moment in the mosque, and we particular mention about supportive care is in cancer is the prevention and also the management of the adverse effects of cancer and its treatment, and also in the process, in the cancer process, what kinds of physical or psychological support related to their symptoms suppose need to deliver to our patients, or included in these concepts. And also in the process, how to help patients to have a better daily function is one of the main goal for the supportive care. So this supportive care in cancer, the concept including very comprehensive across the different aspects of patients' concern and needs. And the second part is, many research have already found a better supportive care even in the lung cancer. There was one very famous publication in New England Journal of Medicine mentioned about the early palliative intervention. Yeah, for advanced lung cancer patient can make a longer survive time and also better life quality. So a better supportive care, or say palliative care, we can help patients have better life quality, even have better survival time. So this supportive care is very, very important, and systematically and also personalized. The supportive care delivered to patients are very important to our patients, particularly in GI patients. They have many discomfort GI symptoms related to the treatment and their disease. So the needs assessment is another important issue currently being assessed, being pointed out during current 15 years. So the needs assessment for patients' needs. So this is for Dr. Fitch from Canada. They have the definition about support care needs. And the survivorship care plan. This one is particular from the IOM. IOM, they mentioned this, the needs for a survivorship care plan for our cancer patients. And so this is provide this supportive survivorship care plan to provide physician, provide to patients, provide to our nurses. They can have a better communication about patients' care plan, and so patient can have a better life quality and less readmission because they have a better care across the across their cancer process. And this is I want to, before I introduce the survivorship care plan, I want to little bit mention about Taiwanese. In Taiwan, we have a #1 instance. This is the latest information. I could not find this is the latest one because I just renewed it this afternoon before the presentation. In Taiwan, our government, this is from government data. We have colorectal cancer, this first instance, and then we have liver cancer. So this is #1, #2 GI cancer, and also #6 esophageal, and also the stomach cancer. So in the top 10 instance of cancers, we have 4 in the GI system. So the GI related cancers are, I can say probably the #1 leading cause of cancers. Yes, in Taiwan. So in GI cancers, we want to use 2 examples. One is colorectal cancer, and the second one is from our recently gastric cancer study. We want to help assess their needs first. So I use the this is Canada's scale. This is a scale developed by an Australian psychologist, but we found it's useful to use in clinical settings. So we want to bring out needs-based assessment first, and then to give an intervention based on patient's needs. So this is this needs SCN is short form 34. They have 5 domains to survey patients' problems. So these 5 domains, psychological and also patient. This is including information needs, supportive care needs, physical daily living needs, and also the psychological and sexual needs. And okay, and this is a score is converted into 0 to 100. 100 means higher score, higher needs. And this one had been published in our Oncology Nursing Forum in 2014, and we found the most 41% patients in colorectal cancer, they have information needs, and also more 1/3 patients they have psychological care needs, and also have generally they have many psychological information needs, and they also have they want to know more about their conditions, and also want to worry about their future, and also worry about the cancer come back or get worse. And so, next one. And however, in the previous five domains scale, we found it's not enough for our GI cancer patients, because they have many concerns about GI symptoms, which is not presented in the previous general psychology developed needs-based needs assessment. So we developed our own. We actually developed a GI-specific needs assessment, including symptom and nutritional management, because this part is very important for our GI patients, and also e-health, because e-health is increasing use of e-health in the process, and daily function, and also cognitive aims, because use many target therapy, sometimes they feel cognitive little bit impairment in the dysfunction in the process. So we found in our GI gastric cancer patient in the current 3 years, we found we survey about 200 patients in the gastric cancer patients, and they received operation within 3 years. So the major concern in the first one is the symptom and the nutrition management, and the healthcare system information, and e-health, and the patient's care support. So the nutrition and symptom support is what they need from our gastric cancer patient. This rank as first, and this we can see this. This is their outcomes. And then, so finally want to show about how to apply the patient's assessment into the survivorship care plan. The survivorship care plan, we use 2 modules. First module is including we want to include in this one. general module. General module is based on our literature review and also our experts also our experts' opinions and also our evidence, different evidence tables, literature review. Then we develop the general module. General module is for every patient. They will give the same structure of the content. So, for example, in the first months after surgery, we want to give you this. You need to know this. So this is fixed. This part is fixed. For every patient in this condition, we will give you the general module, but we will deliver the content that based on the process, the first month, second month, third month, because you have different treatments across the treatment process. Then the personalized module is based on our assessment, because every time we give a patient general module, we also make assessment first. Then we are based on patient personal assessment, and they have different concerns and different problems. We will give them different kind of information. So this is what we do. Actually, we did not do this in GI cancer. We do this in lung cancer, and we have already finished in lung cancer study. We did this in advanced lung cancer and also in early stage lung cancer post operation. So sorry. So patient will be, so we develop this with our physician together. And then we use an automatically calculation system. So we put all our assessment tool into the iPad and calculate directly. So after assessment, you can see patient score and even the combined score in which indicator. So we can give you, and for each indicator, high or low, we link our intervention content to give patients based on their needs. This is for the individual part. And the main module part, including pain control, this every patient will tell them this content, and pulmonary rehab, because this is for lung cancer patients. 1 more minute. And fatigue management and exercise, and also how to maintain exercise, and facing coping with cancer and fear of cancer recurrence. And so each one we make it very simple, but however we make sure we do this. And then we have another one is patient-specific personalized intervention. Based on their assessment, we give them the intervention. So this is a screen tool. We use the quality life assessment tool and also use the needs assessment tool, fear of cancer assessment tool to assess patients' problems. And then the final goal is I think the supportive and survivorship care can help cancer patients and their family can maximize their life quality and their function. So finally, we strongly believe oncology nurses are the power to support cancer patients. This is from NTU Cancer Center, our staff team, and this is. We hope everyone together we can make the cancer care better. So thank you very much.